Thank you. It is a pleasure and an honor for me to present to you today the results of the work that has been undertaken during the last month and a half by the members of the Focal Question 1 team. Our task has been essentially to review the existing literature, including journal papers as well as grey literature, with the objective of identifying the most effective methodologies, but also tools that have been used to identify and enumerate children out of family care. It has become clear in recent years that there is a major data gap in the availability of information on the number and characteristics of children out of family care. Of course, many initiatives and interventions have been developed, and the map that you can see here displays the number of projects by USG that has been implemented to target children out of family care. However, the lack of solid and comprehensive data on children out of family care has clearly posed a major challenge to our ability to develop appropriate and comprehensive policy responses. If we don't know who these children are and where they are, we cannot hope to be able to develop the proper interventions that can meet their needs. And this lack of data is the result of different factors, including technical issues, such as, for instance, the weaknesses of the administrative system. Susan this morning talked about the lack of birth registration, and this is clearly linked to the failure of the administrative systems. But there is also an issue related to the lack of standardized definitions that are needed for the construction and development of appropriate indicators, and the challenges related to the development of proper sampling frame. When we talk about children out of family care, we are not talking about a very homogeneous group. There are many different categories of children that are embedded in this concept of children out of family care. And each one of these children should be treated differently from the statistical point of view, because the data collection and the requirements for data collection are very different from one category to the other. We're talking about street children, we're talking about children in institutions, children are trafficked for commercial sexual exploitation of labor, and as I was saying, the implication for data collection, both in terms of, for instance, of methodology, sampling frame, modeling, and the system to calculate these estimates are very different. If we think about street children, for instance, there are different challenges and different problems related to the development of an appropriate sampling frame. These population of children are, by definition, don't have a permanent residence, which means that the usual probabilistic sampling strategies do not work with these children. They are also very mobile, which means that there is a certain uncertainty in terms of where to locate them, and fluctuation may happen not only seasonally, but also daily. These children have very different living conditions, so they're not, again, an homogeneous group, and we need to have operational definition that can capture the differences in the living arrangement of these children. And finally, these children face stigma, which means that these children are, by definition, hidden. So in other words, these children out of family care are very often sociologically and statistically hard to reach. And these pose a big challenge to data collectors, which means that specific methodology and greater investments are needed to be able to capture and enumerate these children who are deprived of family care. With these challenges in mind, this slide presents a little bit the process that led us to today. We started with the pre-summit work in which the focal team was created. The focal team includes 19 experts that have different levels of expertise and area of expertise. These experts gathered at the pre-summit, and we all decided to work on a specific piece of the work based on our knowledge and our previous experiences. And we started reviewing the evidence that was identified by the core organizer of the Evidence Summit. We originally received 60 articles that we reviewed, but in addition to the 60 articles, we ourselves identified additional pieces of evidence, and in total we reviewed more than 100 articles and grey literature. So we did that during the writing phase. And for each one of the methodologies, we developed a template to be able then to identify the key elements of the methodology in terms of, for instance, the content, the strength, the limitation of the methodology, trying also to support each one of the statements with a solid literature. So all the different templates were drafted by the experts, and then they were put together in the paper that you've received, and it's an folder. So we organized the discussion essentially through web conferences and phone calls. The draft was compiled, revised, and we extracted some key recommendations. Of course, it's important to say this is very much work in progress. There's a lot still that needs to be done, both in terms of reviewing additional literature that we might have not captured, and for this we rely on your suggestion, but also in terms of developing the recommendation. This needs further work, of course. And we faced a number of challenges during this process. Some of the methodologies do not have enough evidence, and you will see this in the package. Some of the methodology cannot really be supported by a lot of research that's been done, and this is clearly an area that needs to be highlighted because it deserves further consideration. In some cases, the paper were presenting the results when a methodology was used, but the papers did not actually went into a discussion of the weaknesses and the strength of the methodology. So the results were presented on the assumption that the methodology was used was the best one for the specific purpose. So we lacked a little bit of methodological papers that had as purpose really the description and the assessment of the different methods. And clearly, we needed a little bit more time to do this type of work, and we hope we're going to be able to do a better job in the future. We organize our work by methodology, rather than by category of vulnerability. We know that all the evidence is structured around group of vulnerable children. We decide to keep these categories in mind, but use a different way of looking at the evidence. We organize the evidence by methods. And we did that because most of the methods can actually be replicable in use with different population of vulnerable children. A couple of considerations on this categorization. We all know that, but it's also something important to reiterate from the point of view of the data collection. Unfortunately, these categories are not mutually exclusive, which means that we need to be able to capture children who actually belong to 1, 2, or 3, or 4 of these different categories. For some of these children, we lack a standardized definition. And for us, from the data collector point of view, this is a big challenge. If we don't know exactly what the target population is, we are not able to develop appropriate sampling, we are not able to develop appropriate indicators. So the lack of a standardized terminology and definition has created a big problem in our ability to develop appropriate response. So even if we think about street children, the concept of street children embeds different categories of children. So there are children living on the street, but they're actually going home at night. Or some of these children are in between. Some period of the year they go home, in other cases, in other seasons they don't go home, depending on the type of relationship they have with the street. So we need also, from data collection point of view, to be able to categorize a little bit better this group of children. These are the methods and the tools that have been identified on the screen. In total, we have 14 between methodologies and tools. So I keep this distinction because clearly, as you can see even in the slide, we have some methodologies together with some tools that have been used and applied in different methodologies. We are not going to go or describe all of them. First, because it takes too much time. Second, it might be a little bit boring. So we have decided to select just 3 of them and give you an example of the work that we did and illustrate what the limitation of strength of the different one. And for this specific exercise, we have decided to focus our attention on the time-location sampling strategy, and then look specifically at the case of household surveys. in this case, generalized households, major household survey, as well as specialized household surveys that have been developed with the specific purpose of capturing a category of vulnerable children. Each methodology, and this is something I was about to forget, has been rated from 1 to 4, 1 being strongest and 4 weakest, in terms of 3 criteria: reliability, validity, and scope. So we've been trying to see whether the methodology can actually capture what we are trying to capture in terms of target population. We also assess the methodology in terms of their ability to produce similar results, even if used at different times. And third, in terms of scope, we look at the ability of the methodology to be generalized and used in alternative settings. So each one of the methodology has been raised based on our expert feedback and the available literature. So the first methodology that we reviewed is the time-location sampling. That is a sampling, probabilistic sampling technique that has been developed to be used with populations that tend to congregate in specific venues and a certain time. This methodology has been used to identify and enumerate different categories of vulnerable children. It's been used extensively, for instance, for street children, but also been used in research and data collection involved children with HIV or adults with HIV or trafficked population, as well as migrant and population that have high level of mobility. There are certain strengths that are linked to this methodology, and that's the reason why it's being widely used, especially in recent years. It allows us to capture a large and diverse sample of the target population, but it also allows us to directly identify and intervene with the provision of service with our target population. It's also a representative technique if appropriate weight procedure are applied, and overall it proved to be quite an efficient way of capturing hard-to-reach population, and specifically certain group of hard-to-reach population. In some cases, it proved to be the only possible way of collecting data. At the same time, this methodology, as well as others, are very labor-intensive in terms of the informational requirements that are needed. So there is a lot of formative research that needs to take place before the methodology is actually implemented in a certain country, and therefore the informational requirements are pretty high. So special studies have to take place before we can even see if a methodology can be used. The second challenge is obviously linked to the most complex part of all the methodologies, which is the identification of a proper sampling frame. We might miss venues, for instance, that are the primary sampling unit. We will miss venues because these venues are hidden, or we might miss certain populations that do not participate or do not congregate in the specific venues. And sometimes you are missing the most vulnerable of all, those who are not even participating or linked or involved in any form of networking. So there are many challenges related to the sampling design, but there are also a lot of challenges related to the sample implementation. Even when you have best possible sampling frame, the implementation might create a challenge. For instance, in a study that UNICEF conducted together with DHS around 2007 about street children, we noticed that after having developed the most comprehensive sampling frame, at the implementation stage, children were no longer there, where they were supposed to be. And we tried to reduce the time between the definition of the sampling and the implementation part to the minimum possible, but still children were not there. Or children were there, but we needed to go there at night, wake them up in the middle of the night, and ask them to participate in an interview. So the challenges at the implementation level are really numerous, as well as the ethical considerations to be taken into consideration. Household surveys. And we wanted to really include household surveys in the discussion, although we are all aware of the big limitations in terms of the ability of this survey of capturing the most vulnerable children. These are household surveys, and therefore, as was said this morning, non-household population is by definition captured. So children living in institutions, children living in the street, they have no connection with a household, they're not captured in these surveys. But these surveys are very often the only source of data for certain developing countries. And they're also very often the only source of systematic data collection that exists in some of the countries. When we look at the time value, for instance, sampling or like the respondent-driven sampling, very often these have been used as part of very specific research projects that have been conducted once, twice, that's all. Household surveys are important because they often become routine data collection efforts, so they can guarantee a sort of sustainability in terms of the information that are provided. And household surveys are able to capture, with limitations, two categories of vulnerable children. Before I go into describing those, let me say something in general very superficially about the methodology. On average, household surveys such as MIX and DHS rely on 400 clusters on average that have been selected with the probability that is linked to their size. And about, again, on average, 20 households are selected in each one of the cluster, and again, the selection is random. So all the household members are listed in the household listing, and thanks to this detailed list of household members, we might be able to capture two categories of vulnerable children. First, children who are out of family care because they are caregiver, they are not recipient of care, they are the ones who provide care because they are part of child-headed household. And the second category of children are those who are in a household because they are domestic servants, so they are unrelated to household members and they belong to the household only because they work for the household. Now there are limitations for the ability of us to capture both groups of children. In the first case, we can only capture child-headed household where there are children above the age of 15 who are in the household. Because if there is nobody in the household below the age of 15, the interview doesn't take place. So the principle is you have to have an adult respondent to be consenting to the process of interview. So we are not capturing child-headed household where there is nobody above the age of 15. And when it comes to domestic workers, again, it's very challenging. Because if you look at the household listing, you are able to see if the child, the subject child, is unrelated to the household head, but you are not clearly or sufficiently able to see if the child is related to other household members that are not the household head. So the way in which sometimes this has been overcome is by asking specifically the question if the subject child is a domestic worker or is a Rastavec. This was done, for instance, in the case of the DHS from 2006. But we know that this information, especially in countries where it's socially stigmatized, you're not able to get this information, these children remain limited. So there are strengths, of course, of the household survey. These methodologies are extremely reliable, large scale. They cover different indicators, so you are able not only to enumerate, but also get information about the living conditions of subject children or the overall population of the family. So from the point of view of the analysis, a very rich source of data and very reliable. But as I was saying, there are many challenges related to the identification of vulnerable children. And there is also another level of weakness, which is the fact that these tools are not meant to be used to provide immediate services. Household surveys are not meant to immediately link what you get from the information that you cover with the service provision. These are two separate sort of interventions. The third and last tools/methodology that we wanted to present to your attention are related to the collection of data for children who have been victims of commercial sexual exploitation. And this is a methodology, and these are tools that have been recently developed and tested by ILO with this specific purpose in mind. Two approaches have been developed. One based on establishment, so these are establishment-based surveys that cover establishment where the actual sexual exploitation takes place, and this has been tested in Bangladesh. And another methodology is a traditional household-based survey that specifically covers commercial sexual exploitation and mix together probabilistic samples in terms of selection of the household together with snowball network sampling, which means that all household members in a specific age category, which is 5 to 25, are identified through the household listing. Specific questions are addressed for this population 5 to 25 in order to validate if they are indeed part of the target population. Then if a family is identified as having one child that has been victim of commercial sexual exploitation, the family is asked to identify, indicate another families where similar practice has been taking place. So in terms of the strength of this methodology, again, this is also something new. The process of testing and validation has been taking place, but is definitely something that requires further work. But as being based on a structured methodology for establishment survey and household survey, it's proved to be capable of generating reliable estimates overall. But of course, there are challenges in terms of being able, again, to identify the primary sampling unions, and additional work needs to be done in order to see how this methodology can be replicated in other settings where it might be more difficult to get this type of information at the household level, for instance, or at the establishment level. So these are the three essentially methodology. For more information about this methodology and other methodologies, you have the review paper in your folders. Now we really ask you to provide us with additional documents that you think are essential to be included in this review and they've been overlooked. So you have the list of reference at the back of the paper, and we'll also look forward to receiving your recommendation for this piece of work. Thank you.
So she provided us a great overview of the work of this group. There have been over 100 pieces of literature. Any comments, reactions, thoughts to this presentation? Especially, go ahead in the back and please come up to the mics. And Jim will let me know if a question comes in from you. There's been some controversy in the past over doing research which involved victims of trafficking and then not linking it to doing anything about those victims. And the U.S. government policy is that if in the course of any other kind of development work that we run into people who have been trafficked and underage, in this case you were talking about, that should be reported. So I'd like to know how we deal with that ethical issue.
So, needless to say, that's a very relevant question, applies to victim of trafficking as well as victim of any other sort of revelation. Since I was not personally involved in the development of this specific methodology, I will ask probably our colleague, Charita, if you want to say something about this since it's been done in collaboration.
Please use the mic.
I think there's two separate, right, I think the person who mentioned this did express a really
Hold the mic towards you there.
express a really important concern. I mean, I think when we fund research, we do have ethical guidelines that we ask our contractors and our grantees to use. And then we also know through the senior policy operating group on trafficking, there are instances in which if there is work being done, that it should be raised to the concern of the local authorities and post. I don't know if that answers, but I think to the extent that we do applications. Our main sort of approach is working with the grantees to make sure they've developed ethical guidelines.
So I think this is going to be a source of conversation when we move to our small group conversations at our table, and the ethical considerations when you're doing enumeration to refer and work with the issues that you're seeing. And so I'll leave that till then. Any other comments on this particular review? Gillian?
Thanks. Special thanks to Group 1. I know you all worked very hard. Nobody missed it. In the case of an emergency response, let's take Haiti, for example, where you have scores of international partners coming in and doing their thing. You see a lot of assistance happening, and often they're not coordinated. So we get, an NGO here, a faith-based group there, a private partner there doing an assessment and counting kids who need services. And these aren't coordinated. I'm wondering if you came across evidence about a coordinated approach and how that might be facilitated, and what, this maybe goes more into the line of recommendations, but how as a funder can we assist to make sure that efforts to identify and enumerate kids for the purpose of intervention can be better coordinated. Are there any examples out there that speak to a job better done?
Speaking for myself, and I actually look at my colleagues in case they came across, I did not come across any article that actually addressed this issue of coordination, even in research and data collection efforts. So unfortunately, we did not come across.
Sorry, just to add, we briefly wrote on the monitoring system, so the child labor monitoring system, and then I forget what the other monitoring system is called. And I think there's another piece that we didn't get to go into much depth, but there's a case study of different NGO groups working in Nepal in response to the children in armed conflict when they were looking at that. So that's just the piece that we have in there, but we need to develop a little bit.
The child protection monitoring system,
right,
is described in the evidence packet, and that provides a framework for doing some coordination around gathering information on kids separated from their families.
So that's a methodology that they looked at.
Right.
That shows promise.
And it's been used. I think many people in this room are very familiar with it in different contexts. And it's a system that can be used. It's a multi-agency system. It can be used in different geographical areas, but then the information is combined, and there's a giant database that helps to manage cases across agencies, different geographical locations.
Susan, go ahead. I'm sorry, you're coming.
That was a really good review, and I really appreciated it. There are some countries that are much more geographically based, and so if you just thought of Thailand, where there is an epidemiological monitor, 1 of every 10 citizens, and especially for a lot of child issues, you're going to get so much overlap in how you define those child situations that the geographically based entire country overviews are really, there are some really outstanding national examples. China does it for infectious diseases, not the same thing as homeless youth. If they wanted to monitor homeless youth, they could, but Thailand in particular has health surveillance on an ongoing basis at the level of 1 in every 10 people in the entire country. And these are really geographically based systems which the countries are now tying to their GIS mobile phone kind of monitoring. And I think very soon we could be moving towards. And it moves our definitional categories away from individuals and labels of where the individual pathways have been, jail, out of home, child head of household, to more situational based, which make it easier to intervene at a structural level rather than at a child level.
Any response from the team about that? Thank you for sharing that. Go ahead.
First, I want to congratulate Claudia and Tom for pulling this together. It was really good. Congratulations to you and your group. One of the questions that I had was whether or not it would be appropriate to consider a specific section on data collection ethics. Because I know that the issue that was brought up about trafficking actually applies to many of the data collection methodologies that are described. The other question I had is if you would give any consideration to multiple indicators and how those might be assembled in developing data about some of these populations.
Well, definitely we've been thinking about having a specific section on ethics. It's something that came across all the different methodologies that we've been looking at. Some because of the sensitivity of the issue, in other cases specifically because of the age of the respondents and the mechanism for the protection of the confidentiality of the information, as well as provision of assistance and referral mechanism for victims, for children who have been victim of certain specific abuse. So we definitely would like to include a piece of the paper about these. We are also thinking on a different matter to include some consideration about, for instance, the importance of having a solid administrative system in place because of the birth registration is a key element, but also because when it comes to children in institution, having a clear mapping at the country level of how many institutions exist from the point of view of data collection solve half of the problems that we might have. So one of the parts of the paper that we might want to strengthen is about the policies, interventions that are the basis of any data collection and can facilitate the process of data collection. So thanks a lot for the suggestion.
What percentage of those children are unassociated with families, but by focusing on the sexually exploited children or the forced labor and others, we sometimes forget that there's, of this 151 million children who have been identified as being forced, there is a very high percentage who are voluntary migrants, who are living in the establishment where they work, who are working in, as we mentioned already, in child domestic labor. So we have a very huge population here, which we have found benefits in enumerating these children and identifying these children. It benefits from having a mix of different methodologies. And I think this is one of the things that comes out more in the evidence paper. And thank you so much, Claudia, for an excellent presentation.
Thank you. Is there a comment here? Okay. If there's not, we're going to move into thank Claudia for a terrific